I encounter patients who utilize fragranced soaps, driven by a desire for a specific olfactory profile. Others engage in excessive scrubbing or even internal irrigation, rinsing, based on outdated advice from media or lay sources. I must inform you that these practices can be counterproductive, frequently leading to xerosis, a dryness, irritation, and recurrent infections. Today, we will definitively clarify this confusion. I will detail the evidence-based protocol for how women over 60 should cleanse the vulva and the vagina. And yes, the anatomical and functional distinction between the two is paramount. Once you comprehend which internal structure must remain undisturbed and which external area requires gentle, specific care, the entire hygiene process will become rational and effective. Before we commence, I invite you to share your age and current location in the comments, as I value connecting with our diverse audience. Every woman is entitled to clear, honest, medical information regarding safe, intimate hygiene. The reality is that many women adhere to routines that are silently damaging the very area they intend to protect. You have been culturally conditioned to believe that cleanliness necessitates aggressive scrubbing, that odor signifies shame, and that soap equals safety. In fact, these habits frequently perpetuate the discomfort. I urge you to consider a critical point. You may have been practicing the exact same routine for decades, assuming its correctness. But what if that single, daily habit is the proximate cause of recurring irritation? What if the pursuit of feeling clean has been detrimental to your health? I will provide the pathophysiological explanation, and by the conclusion of this discussion, you will understand the truth about what your body actually requires to maintain optimal balance, comfort, and health. Welcome back to the Female Health Podcast, where we speak openly and honestly about women's intimate well-being post-60. I am Dr. Lily Stones, a gynecologist and specialist in intimate health psychology. For over 3 decades, I have supported women through every life stage, from the complexities of menopause to the private struggles that too many keep hidden. This topic may seem simplistic, but I assure you it is one of the most frequently misunderstood subjects in women's health. We will deconstruct the myths, establish the clear do's and don'ts, and identify the small modifications that can shield you from years of irritation. I must insist you stay until the very end, because one of the habits we will discuss, the one most women never question, is potentially the most damaging of all. When you learn this, you will understand why so many women continue to experience distress even when they believe they are implementing correct practices. Let us begin at the foundational level to eliminate the largest source of confusion. Before you can cleanse correctly, you must first identify what you are cleansing. This is where the initial error often occurs. Let's establish the anatomical difference immediately. Most women, when they say vagina, are actually referring to their vulva. This distinction is clinically crucial because it dictates your self-care approach. The two structures are adjacent, but their roles are fundamentally different, and confusing them leads to unnecessary and often painful habits. Your vagina is an internal organ. It is not externally visible. It is a muscular conduit connecting the cervix, the neck of the womb, to the external environment. It is hidden, protected, and inherently self-sufficient. Indeed, it possesses its own natural, sophisticated cleaning system. The mucosal lining produces secretions known as discharge that naturally mobilize and carry away old cells, bacteria, and residual menstrual blood. Furthermore, the vagina maintains a highly specific acidic pH environment, which serves as a protective barrier against ascending infections. It is an incredibly effective self-regulating design. The vulva, conversely, is an entirely different structure. This is the external part you can see and touch. It comprises the labia majora, outer lips, and labia minoris, inner lips, the clitoris, the clitoral hood, and the pubic mound, the tissue cushion above the pubic bone. Collectively, this is your vulva. I conceptualize it this way: if your vulva is the picture frame, the vagina is the picture itself. The frame is exposed and requires gentle, external care. The picture is safely tucked away and is protected by nature, thus remaining untouched. When women attempt to treat both the picture and the frame identically, problems inevitably arise. This distinction is even more vital post-60, because the skin of the vulva undergoes change with age. As estrogen levels decline, the skin becomes thinner, less elastic, and demonstrably more sensitive, atrophic. What was tolerable 20 years ago may now induce irritation simply because the skin lacks the same natural resilience, oils, and moisture. If you've questioned why your long-standing washing routine suddenly feels harsh, this is the explanation: your body is adapting, and your care regimen must adapt with it. The vagina, conversely, remains self-cleaning throughout the lifespan. It requires no soap, no internal rinsing, and no plain water internally. When you interfere, you disrupt and remove the very protective bacterial flora that safeguards you. For now, commit this to memory: the vagina is self-cleaning, the vulva is not. One is untouched, the other requires gentle, informed attention. Before detailing the precise cleansing method, I ask you to pause and visualize this difference. Ponder this distinction every time you enter the shower. Understanding what you are washing and what you are not is the cornerstone of proper hygiene. In a moment, I will demonstrate how to give your vulva the necessary care without provoking the irritation you are trying to prevent. Have you ever experienced recurrent irritation despite frequent washing? The immediate, logical impulse is to increase the frequency or intensity of cleansing, perhaps washing twice or scrubbing slightly harder, believing this will finally achieve freshness. But here is the key clinical point for women over 6 that very habit is often the reason the irritation persists. When you overwash or scrub aggressively, you do not eliminate the issue. You eliminate your natural protection. The vulvar skin is not comparable to the thick skin on your limbs. It is thinner, more delicate, and highly susceptible to injury. Each instance of scrubbing, even if perceived as gentle, causes minute micro tears. These invisible breaches invite irritation, cirrhosis, and sometimes secondary infections that mimic burning or stinging, even in the absence of an ascending infection. This establishes a vicious cycle. The more you wash, the drier and more sensitive the tissue becomes. The drier it becomes, the more the perceived need to wash is reinforced. This loop is self-perpetuating. Post-60. Due to the natural decline in estrogen, your skin simply lacks the former capacity to recover. What was harmless decades ago can now leave the tissue raw and inflamed. I have managed cases where women were certain of a recurrent urinary tract infection, UTI, only to find their aggressive hygiene routine was the true etiological factor. The solution is not total cessation of washing. It is a return to gentle, respectful care: tepid water, a mild, unscented cleanser, and your clean hands instead of abrasive cloths or sponges. Nothing harsh, nothing scented, nothing that causes post-cleansing discomfort. Focus on softness, not friction. For those experiencing dryness or the tight, uncomfortable sensation post-cleansing, specialized moisturizing products exist to soothe rather than strip. I advise exploring vaginal moisturizers which aid in maintaining natural post-menopausal comfort. These are not perfumes or cosmetic lotions. They are gentle adjuncts that support your body's natural balance. When you treat your skin with kindness, it initiates the healing process. The irritation softens, the pruritus, itching fades, and the constant sensory awareness of discomfort begins to recede. Only then will the full extent of the damage caused by over-cleansing become apparent. But before you assume the problem is solved, I require your continued attention. The next mistake is not about frequency of cleansing. It is about location. The following habit, seemingly innocuous, may be the most damaging of all. Now that we've addressed over-cleansing the external area, let's examine a practice that is even more profound. For many women, this is an almost unbelievable concept. It is a habit that, on the surface, appears perfectly logical: stepping into the shower and reasoning. If washing the outside promotes cleanliness, surely rinsing a little inside will make me even cleaner. This sounds responsible, yet it is one of the most severe clinical errors I observe, and it is silently harming more women over 60 than you can imagine. I want you to regard your vagina for a moment, not as something fragile or contaminated, but as a robust living system. Internally, the walls produce a natural fluid discharge. This fluid is not a sign of impurity. It is your body's built-in physiological cleanser. It traverses the canal, washing away dead cells, bacteria, and old blood traces. This is a constant, autonomous process, your body executing its design function. The vagina also meticulously maintains its chemical homeostasis. Its pH is naturally acidic, and this acidity serves as your primary defense mechanism against pathogenic bacteria and ascending infections. This system is exquisitely balanced until it is interfered with. When you introduce rinsing internally, even with plain water, you disrupt that system. When you use soaps or commercial douches, you don't just eliminate pathogenic bacteria, you eliminate the crucial, protective lactobacillus species upon which your body relies for health. This is the genesis of the problem. Once the healthy flora is decimated, harmful organisms proliferate more rapidly. You notice olfactory changes, thicker discharge, or pruritus that suggests an infection. You may receive treatment and experience temporary relief, but if the internal rinsing continues, the symptoms will inevitably recur. The issue is not the infection recurring, it is the damage to your essential balance that is repeatedly re-inflicted. I have seen this countless times. A patient, frustrated and exhausted, states, "Doctor, I wash every day, yet the infection returns." When I inquire about her method, she reveals she directs the shower spray internally because it feels fresh. She believes she was safeguarding herself, but she was systematically removing the body's natural line of defense. Once she ceased internal rinsing, her symptoms resolved, and she returned to a state of normality for the first time in years. It is imperative to remember, the vagina does not require assistance to remain clean. It is one of the few organs that is autonomously self-sufficient. You would not scrub the inside of your eyes to keep them clear, you trust your tear film to perform the function. The vagina operates on the same principle. Any internal rinsing, douching, or use of soap interrupts a process that was never meant to be disturbed. This is especially critical post-60. As estrogen levels decline, the vaginal lining becomes thinner and more sensitive. What once felt refreshing can now cause burning or micro-abrasions that increase vulnerability to infection. You may not see them, but you feel them: the subtle stinging, the dryness, the lingering discomfort. Therefore, my clear directive is this: cleans only the external structures, the vulva, where sweat, oils, and external bacteria accumulate. The internal vagina must be left entirely alone. The less you interfere, the healthier the system will remain. Now, we must examine a third mistake, one that feels harmless, even aesthetic, but quietly antagonizes everything your body strives to do. It hides behind the promise of freshness. Let's discuss something seemingly pleasant: the fresh scent, the promise of feminine confidence. The notion that cleanliness must possess a floral aroma. For many women, this olfactory messaging is deeply ingrained. Consequently, when you notice a natural change in scent, perhaps stronger or different post-menopause, the instinct is to mask it, to reach for a spray, powder, wipe, or deodorant. But here is the clinical truth. These products do not protect you. They conceal the underlying issue, and in doing so, they exacerbate the problem. The scent you attempt to mask is not your adversary. It is your body's messenger. That subtle odor is the vagina's way of signaling a shift in balance, perhaps a pH change, a struggle with healthy bacteria, or excessive tissue dryness. When you overlay perfume onto that signal, you silence the warning, and this allows minor issues to quietly escalate. Fragranced wipes, powders, and sprays offer immediate but temporary relief. However, beneath the surface, the delicate vulvar skin is reacting. The fragrances and alcohols strip away natural oils, promoting cirrhosis and creating invisible micro-fissures. Through these breaches, bacteria and yeast can ingress, leading to irritation, pruritus, and ironically, an even stronger odor than before. This is a vicious cycle. The more you attempt to conceal, the worse the condition becomes. Post-60, this risk is amplified. Post-menopausal skin is thinner and less resilient. The labia majora loses some of its natural adipose cushioning. Thus, every chemical, every trace of alcohol or perfume penetrates more deeply than it once did. What may have caused mild erythema redness in your 40s can now result in days of soreness. You may notice burning during coitus or even after prolonged sitting. Yet, many women never suspect that their freshening routine is the culprit. I have seen women in my office carrying entire arsenals of fragrance products. wipes, sprays, powders, perfumed soaps. They genuinely believe they are adhering to a correct standard. They are misled by marketing that suggests these products are necessary for cleanliness. They are not. Your body is self-aware. It never required perfume to smell healthy. It only requires balance. My recommendation is clear. If you feel the temptation to freshen up, pause. Ask what your body is truly requesting. Is it dryness? Then it needs moisture. Is it odor? Then your natural bacterial flora may require support to restore balance. Support your body's corrective ability instead of masking the symptom. I encourage the use of gentle, fragrance-free options that soothe irritation and maintain natural comfort. I have included a link in the description with more information about vaginal moisturizers. These are not perfumes, not deodorants. They are products designed to work synergistically with your body, not against it. They help restore the soft, healthy balance that keeps your vulva comfortable and calm. Remember, your natural scent is not a source of shame. It is a sign that your body is alive, functioning, and self-regulating. When you cease fighting it, your confidence returns. You stop worrying about every minor change because you finally understand what is physiologically normal and what is not. Now that you understand how fragrances can quietly undo your best intentions, I need you to stay with me for the final, critical mistake. This one hides in a completely different place, your closet. And most women never suspect it has anything to do with vaginal health. This final mistake does not occur in your bathroom. It occurs in your closet. You slip into your favorite tight trousers, lace underwear, or comfortable synthetic leggings. It feels routine. It feels harmless. But for the vulvar skin, it can initiate another cycle of irritation that you failed to connect to the problem. The good news is that this mistake is easily rectified. Soft, breathable cotton facilitates airflow, absorbs moisture, and aids in maintaining calm, balanced skin. When at home, transition to looser, more comfortable attire. And at night, allow your body a chance to rest and recover. Sleeping without underwear can provide a more significant benefit than you might anticipate. Synthetic fabrics such as nylon, polyester, and lace are non-breathable. They trap heat and moisture against the body, creating the ideal microclimate for bacterial and yeast proliferation. Compound this with a few hours of sitting or light physical activity, and that trapped moisture quickly turns into chafing, irritation, or another flare-up that mimics infection, but is in fact an environmental irritant. It is not just the fabric, the fit matters too. Tight underwear and constrictive trousers compress the delicate folds of the vulva, impeding air circulation. This friction can cause redness, soreness, and, over time, the same micro-tears that over-cleansing causes. I often instruct my patients, your skin requires airflow as much as your lungs require oxygen. Caring for yourself is not confined to the shower. It involves every subsequent decision, from how you dry to what you wear to how you allow your skin to recover overnight. It is all interconnected. When you make small, informed changes in each of these areas, the cumulative difference translates into lasting comfort. Every woman deserves to feel comfortable, fresh, and confident in her own body. When you understand what to cleanse, what to leave undisturbed, and even what to wear, you provide your body with precisely what it has been requesting all along: care that is kind, simple, and tailored for you.